Hello, and welcome to animatedteeth.com and our page that discusses the treatment of dry sockets, or, as your dentist would say, alveolar osteitis. Actually, we have 2 pages on our website that discuss this subject. This one that explains how dentists treat this complication. The other discusses possibilities with self-treatment. Without question, your better hope of finding substantial relief comes from your dentist. And as your treatment provider, they have an obligation to assist you with whatever postoperative complications you encounter. Usually, you'll find they have a genuine eagerness in following through with their work and take pride in seeing that you're taken care of. So, be in touch with them. As a first step, your dentist will need to establish that it's likely that you do indeed have a dry socket. We have a separate page and video that discusses the usual signs and symptoms of this complication. So, here we'll just mention that arriving at a correct diagnosis is usually pretty easy for them based on a combination of the symptoms you've noticed and their timing. So, if you've called and spoken to them, or even just your presence at their office a few days after having had your extraction, well, they'll have a strong, probably correct, suspicion about what your problem is. As a bit of negative news, we'll point out that your dentist doesn't really have a cure to offer. A dry socket involves a situation where normal extraction site healing has been interrupted and therefore delayed. And no one can do anything about that. Your body simply needs time to regroup and get the healing process back on track. Until that happens, you're left experiencing the pain associated with exposed, irritated, and inflamed extraction site tissues. Fortunately, these symptoms are something your dentist can do something about. Dry socket treatments are palliative in nature, meaning their focus is helping you manage the pain you're experiencing until that point in time when your body's healing process has resolved your condition. This treatment usually takes a dual approach. First, it always involves placing medication inside your socket that characteristically, and amazingly, is able to provide substantial relief. As a second front, they may utilize oral pain relievers, either over-the-counter or prescription, depending on your needs. Of the two, it's the medication, typically a paste, that your dentist places inside your dry socket that's the most effective in making you feel better. Exactly what's in the concoction, typically just called dry socket paste, can vary depending on its source, either self-formulated by the dentist or a purchased product. But all of these kinds of pastes are usually similar in the fact that they include the ingredient eugenol. Eugenol is also called oil of cloves, like the spice. And FYI, its smell is one of the main odors usually associated with dentist offices. What the dentist does is this. They'll first gently rinse the debris out of your socket. And, by the way, getting a good look into it like this helps them to confirm their diagnosis of alveolar osteitis. They'll then put some of their dry socket paste on a carrier, like a small piece of gauze or cotton, and then they'll tuck that down into your socket using a pair of dental tweezers. And yes, doing that step might hurt for a split second. Once finished, they'll send you on your way. The onset of relief can be quite rapid, possibly amazingly so. The idea is you'll stop by and they'll remove and replace the medicated cotton every day or two until your symptoms subside. As we said previously, this treatment doesn't cure or speed up the dry socket's healing. It just provides pain relief. So, it's repeated as needed to keep you comfortable but not beyond. As a second front, your dentist may discuss the use of over-the-counter or prescription pain relievers with you. But typically, these are only used for additional pain relief, and, once again, only as needed. Often, the placement of the paste alone is all that's required to manage your discomfort. In contrast, the use of pain pills by themselves is frequently ineffective. As one last point, keep in mind that a dry socket is typically a situation involving interrupted and delayed healing, without the presence of infection. So, for that reason, the use of antibiotics is not usually indicated. Hopefully this video has convinced you that seeking your dentist's assistance is the key to finding dry socket relief. So, go ahead and let them know that you need their help. They'd be disappointed if you didn't. Good luck and goodbye.